Medical signs and symptoms. Signs and symptoms are abnormalities that can indicate a potential medical condition, whereas a symptom is subjective, that is apparent only to the patient, for example back pain or fatigue. A sign is an objective evidence of a disease that can be observed by others, for example a skin rash or lump. The signs of an illness are things that a doctor or nurse can see and measure. Signs are things like rash, bleeding, cyanosis, coughing, temperature, heart rate, blood pressure, and respiration rate are all signs because you can measure them. Subjective symptoms are things which a patient experiences but others can't always see, such as dizziness, nausea, itching, or a heartburn are examples of subjective symptoms. The symptoms which make a patient seek medical help in the first place are called the presenting symptoms. Medics describe them in terms of being either strong, mild, or weak. Sometimes the symptoms of serious illnesses like cancer and diabetes are weak. They stay weak for a long time and the illness remains undiagnosed. The doctor or healthcare professional may come to any conclusion by observing and diagnosing the body. These measures can be a blood test, checking pulse rate, X-ray, body temperature, hence indicating the definite signs of the disease. For example, heart disease, allergies, cancer, HIV, diabetes are diagnosed under medical expert. These cannot be determined by our own, as the signs are the physical demonstration of one's body's problems. But when the person feels body pain, muscle fatigue, or a headache, these can be termed as symptoms, as here the person who suffers is answerable to his or her problems. Signs and symptoms are helpful in understanding the disease better so that proper medication can be provided, but one is felt by the patient while the other is diagnosed by healthcare professionals. Many illnesses have the same symptoms. These symptoms are called non-specific. Fatigue and fever are examples of these. These are symptoms for many kinds of illnesses, both chronic and acute, and of both physical and mental disorders. Another example would be coughing and a runny nose, which might indicate a common cold, an influenza, or even an allergy. The presence of rashes, itching, or scratching might reveal a dermatological problem which requires further investigations like laboratory tests such as CBC, complete blood count, sputum, samples of your urine or feces. Other medical investigations include instrumental findings via MRI, ultrasound imaging, and other medical equipment. Besides the specific and non-specific signs and symptoms, there are so-called pathogenomic signs that are so characteristic of a disease that these can be used to make a diagnosis. For example, Koplik spots in the mouth, opposite the first and second upper molars, are pathogenomic of measles, or Negri bodies found within the nerve cells and considered a hallmark of rabies virus infection. A combination of signs and symptoms together with laboratory and instrumental investigations would bring a clearer clinical picture upon the medical condition of the patient. Doctors would ask the patients about the onset of the symptoms, what they feel like, what relieves them, what makes them worse. The more detail they have, the faster they can make a diagnosis. While there is a technical difference between the two words, in a medical sense, what's more important is the information surrounding them. As you are reading up on any medical condition or talking with your healthcare team, pay attention to both the signs and the symptoms in the context of your health, particularly in an emergency.